Ala-Scalp Lotion is a medication used to treat a variety of skin conditions, including insect bites, poison oak/ivy, eczema, dermatitis, allergies, rash, itching of the outer female genitals, and anal itching. It contains hydrocortisone, which helps reduce swelling, itching, and redness associated with these conditions. It is considered a mild corticosteroid. For optimal results, apply the lotion to the affected area according to the directions provided by your healthcare provider. It is important to use the medication as directed and to not exceed the recommended dosage. Always consult with a healthcare professional before using this medication. When using Ala-Scalp Lotion, it's important to only apply it to the skin and avoid using it on the face or underarms unless directed by your doctor. If using the lotion or foam, be sure to shake it well before applying. The recommended usage is up to 4 times a day, or as directed by your doctor or the product package. The dosage and length of treatment will depend on the specific condition being treated. Remember to wash your hands after applying the lotion, unless you are treating your hands. Avoid contact with the eyes, nose, or mouth, and rinse with water if the medication gets in these areas. If irritation occurs or persists, it's important to contact your doctor right away. Use the medication only as prescribed and do not use it for longer than directed. If your condition does not improve after 7 days, or if it gets worse, consult your doctor. When using Ala-Scalp Lotion, you may experience stinging, burning, irritation, dryness, or redness at the application site. You might also notice acne, unusual hair growth, small red bumps on the skin, folliculitis, skin thinning/discoloration, or stretch marks. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. If your doctor has prescribed this medication for you, they have determined that the benefit to you outweighs the risk of potential side effects. Most people using this medication do not experience serious side effects. If the treated area starts to bleed, especially if you are using this product for anal itching, make sure to contact your doctor right away. While very rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects. You may also report side effects to Health Canada at 1-866-234-2345. Before using Ala-Scalp Lotion, it's important to consult your doctor or pharmacist if you have any allergies or health problems. This product may contain ingredients that can cause allergic reactions. If you have itching of the outer female genitals with vaginal discharge, be sure to consult your doctor before using this product. Do not use Ala-Scalp Lotion if there is an infection or sore in the area to be treated. Skin infections can become worse when using this medication. If redness, swelling, or irritation does not improve, be sure to tell your doctor promptly. If you're using Ala-Scalp Lotion on children, it's important to consult your doctor for more details, as children may be more sensitive to the effects of corticosteroid medication. During pregnancy, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk when applied to the skin, so be sure to consult your doctor before breastfeeding. When using Ala-Scalp Lotion, it's important to be aware of potential drug interactions. This means that the way your other medications work could be affected, or you could be at a higher risk for serious side effects. It's important to keep a list of all the products you use, including both prescription and over-the-counter drugs, as well as any herbal products, and share this with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without first getting approval from your doctor. Always consult with a healthcare professional before making any changes to your medication routine. If this medicine is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contacting a poison control center right away is crucial. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can reach out to a provincial poison control center for assistance. Remember, Ala-Scalp Lotion is prescribed specifically for your current condition by your doctor, so do not share it with others or use it for any other skin problems without consulting your doctor first. It's important to attend all medical and lab appointments as recommended. If you forget to use Ala-Scalp Lotion at the scheduled time, you can apply it as soon as you remember. If it's almost time for your next application, just skip the missed dose and continue with your regular schedule. Do not apply a double dose to make up for the missed one. Make sure to check the storage information on the package and keep Ala-Scalp Lotion away from light and moisture. If you have any concerns about how to store it, ask your pharmacist for guidance. Always remember to keep all medications out of reach of children and pets. When it comes to getting rid of Ala-Scalp Lotion, do not flush it down the toilet or pour it into a drain unless specifically instructed. Make sure to properly discard the product and it has expired or is no longer needed. If you are unsure how to do this, consult your pharmacist or local waste disposal company for advice. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.